Everything I do is vision driven. Every lesion I look at, when I'm looking under the microscope to check for skin cancer, when I'm doing the closures, everything I do is vision driven. So my career is my eyesight. Before lens replacement, I was basically in that stage where you can't see anything on your phone unless you hold it out here. Couldn't read with a book up close, was having to get readers, hated wearing readers, was looking at getting the multifocal contact lenses. Tried those, I would get nauseous, I would get a headache, couldn't see well, and I'm looking under a microscope a lot at work, having to look up close at patients, and all that eye change was just giving me headaches and giving me a lot of frustration. In our recreation life, we like to go to the lake, and we do wakeboarding, wake surfing, and I was always having issues with my contacts, getting dry from the wind, jumping in the water, maybe one's gonna fall out, and if I lose a contact, I cannot see. I can't drive us back. I'm useless. And so it was always unnerving to me if I had any issues with my contacts. So I had glasses in 1982, contacts in 1986, so 36 years of contacts. But I had 2700 vision in the right eye and 2600 in the left eye. So it was corrected well with contacts, but it was a big strain on my eye getting it corrected from that bad of a vision. Just as a surgeon that depends so much on my eyes, it was incredibly critical that I chose a surgeon that I felt comfortable with, because I basically put my career in his hands and there wasn't anybody else that I wanted to do it other than Dr. Luke. I wanted to be able to see far away and see up close without contacts or readers or bifocals, which were all in my future. I was hoping for 2020, but as of my follow-up appointment at 1 month, it was 2014. So better than perfect. My wife says it's like the greatest medical miracle she's ever seen, because she knew how bad my vision was. So she would say it was a gift, and my 10-year practice anniversary is coming up this summer, so it was kind of a 10-year practice anniversary gift to myself. But I would also say it's an investment in my career and in myself, because, like I said earlier, my eyes are everything for what I do. I would say lens replacement with Dr. Luke has definitely given me even more confidence in what I'm doing, just being able to see even better, even more precisely. And I feel like it's gonna extend my career without having to go into all the bifocals and multifocal lenses and all the vision issues that I've seen other dermatologists deal with as they get older. So this is one of the neat things about having lens replacement. I basically had cataract prevention surgery. And so I won't ever have cataracts. I won't ever have that issue and have to go in and have them gradually treated one after the other and then have lenses replaced when I'm 65 or 70. So, and my vision should continue to stay this way, and if not, they have a touch-up plan. I don't feel like I can put a price on it. I mean, I feel like it was invaluable for me for lifestyle purposes and for career purposes and just comfort purposes. I got more than what I bargained for. I have zero regrets and zero complaints about my experience with 43 Vision. Dr. Luke, you guys were awesome. Everybody was awesome, top to bottom. Had a great experience. My son is there right now getting his eyes done. And that's how confident we are in you guys. Thank you, I appreciate you guys.